My name is Tiffany Gill. I am a lead quality nurse consultant for the Telecritical Care Department at Kaiser Permanente in the Northern California region. I am a master's prepared nurse with 20 years of healthcare experience, including 10 years as a critical care nurse. In my current role in Telecritical Care Department, I work alongside our bedside colleagues to care for ICU patients through a proactive workflow while also triaging and responding to requests from bedside staff. I would like to thank the JBI for allowing me to share my thoughts and commentary on the prevention of hospital-acquired pressure injury among adult immobilized patients in a mental health department, a best practice implementation project. I would also like to thank my executive director, Elizabeth Screws, for her continued support and education, and mentor, Bronwyn Cox, who assisted and guided me in this podcast. Preventing pressure injuries is a significant challenge for health professionals all over the world in a wide range of patient populations. Therefore, I found this article an interesting read and was thrilled to provide my commentary. The project was carried out by a collaboration protocol between nurses, midwives, and medical assistants in the Romanian Bucharest branch and the management of Professor Dr. Al Obrea Psychiatric Hospital. The aim of this implementation project was to promote evidence-based practices regarding hospital-acquired pressure injury prevention practices among immobilized adult patients in a mental health department and to measure the level of compliance with the best practice in this field. The Best Practices Project was carried out in a mental health department with 70 beds at Bucharest's largest mental health hospital. Using the JBI PACES tool, the project team developed a baseline audit of current practices to prevent pressure injury on March 1st, 2020 and April 30th, 2020. The sample included 22 patients, representing all patients consecutively hospitalized during this period, regardless of the type of immobility. In addition, all other risk factors for the development of pressure injury were considered, such as age, urinary or bowel incontinence, malnutrition, chronic diseases, and the impairment of cognitive status. As noted in this study, pressure injuries have significant restrictions on the patient's quality of life, affects the patients physically, psychologically, and socially, leads to increased costs and length of hospital stay, and are closely linked to increased mortality. Immobility, reduced nocturnal movements such as increased skin fragility and poor nutrition all can contribute to the development of pressure injury in bedbound psychiatric patients. In this article, patients underwent a head-to-toe assessment to identify occurrence of pressure injury. Assessments are carried out within 8 hours of presentation to the health facility. Patients underwent a nutritional screening. They were also educated and trained for prevention of pressure injuries, how to reposition or position to reduce the duration and extent of pressure over the vulnerable areas, including bone protrusion and heels. Patients that were at risk for developing pressure injuries were assessed at least daily. Patients not at risk were assessed weekly. Patient at risk for pressure injury received protein-rich or nutrition supplements in addition to their diet. Also, patients at risk for developing pressure injury received their appropriate pressure relieving mattress and possible additional devices. Some of the challenges or limitations this study faced were the small number of patients of 22 and COVID-19 because additional measures were needed to prevent and limit infection, and the educational intervention was conducted in a hybrid manner. Some of the barriers faced were inadequate knowledge of nurses in the prevention of PI, overloading of the nurses, lack of protocols for the prevention of PI, lack of mattresses and cushions for pressure redistribution, and the lack of patient information materials on PI prevention and management. Regarding regarding the limitation of sample size, the article left me thinking. Can you create change based on this small sample size? On one hand, it's great that there weren't more immobilized psychiatric patients, but if they treat so few, will they continue this practice? With so few patients, will the providers of Romania retain the education and prevention practices learned? In this patient population, how often are the patients receptive to the patient education provided? I found myself thinking about the current practices that I have witnessed at some of the facilities that I've worked at. Most facilities use the Braden score, a standardized evidence-based practice tool commonly used in healthcare to assess and document a patient's risk for developing pressure ulcer. Upon admission, patients are assessed, areas of concern are possibly photographed, possible wound consult, possible protection based on if it's a foam dressing or medication. Facilities that have resources like a wound care nurse will assess a patient within 24 hours, treat based on clinical knowledge and evidence-based practice, and place orders on how to continue to treat those areas. So it is most definitely a team approach with the bedside staff and wound care nurse. Staffing shortage is a nationwide issue, but in most cases, I personally have had staff available to assist with wound care if needed. With all the resources possible, this still does not prevent 100% of wounds. However, I am grateful for the access to materials and resources available to help prevent PIs. Despite the challenges faced, I believe this study was a success, process improvement for the nurses. Compliance was radically improved, obtaining maximum percentage of 100% for all these activities: patient assessment, use of assessment tools, use of necessary devices, provision of high protein diet, and patient education. This project contributed to the standardization and improvement of nurse practices of pressure injury prevention in patients with mental illness and immobility hospitalized in a psychiatric ward. It was great to read that the audit compliance at the follow-up stages showed significant improvement. However, it will be great to ensure that this can be sustained with periodic audits and plan for annual education of this important topic. Thank you so much.